Hello, my name is Miriam Dreesen, and my public issue topic is maternal obesity. I decided to choose maternal obesity as my public issue topic because I am a sonographer, and during my last clinical site, I was at the perinatology clinic at Methodist Women's Hospital. And one of the main issues that we saw for people being referred to perinatologists was that they were overweight for their pregnancy and required additional monitoring during their pregnancy. And so I felt like it was a very pertinent issue to the world and specifically within the Omaha metro area because I was able to see a big majority of it. So, some definitions in terms of what actually maternal obesity is. So, a normal maternal weight gain during pregnancy is about 35 pounds, and any BMI during pregnancy that's greater than 30 is considered obesity, maternal obesity. And then there's other ranging factors for like how severe the obesity is. Below are some terms that I think are important and helpful to know when talking about maternal obesity, just because they're risk factors associated with pregnancy. Gestational diabetes and hypertension are just maternal onset of these symptoms. Large for gestational age and small for gestational age are risk factors associated with maternal obesity. And also, I did a lot of research over preterm delivery because gestational diabetes and hypertension are causes for preterm deliveries. So, what is the problem? Well, overall, I'm sure a lot of us are familiar that obesity is a growing problem not only in the United States, not only in the Omaha metro area, but worldwide. Particularly, there's also been a steady increase in history of women in reproductive age, increasing BMI and increasing weight. And maternal obesity itself actually affects about 20% of pregnancies. So, if there was one easy cause for any kind of obesity, we would be a lot healthier of a nation and of an area. But causes of maternal obesity are similar to those of just general obesity. The risk factors include socioeconomic status, hereditary factors, and then mostly sedentary lifestyles. According to the CDC, the United States obesity rate really began to be on the rise in the 1990s. And with that, the maternal obesity rate also steadily increased with that, which is expected because most women are able to get pregnant. So the demographics of this issue kind of fall more under the general obesity terms than anything, but maternal obesity is not proportionate across all races, and it's actually most rapidly increasing around the African American population, and low-income households and low-income people are more likely to have maternal obesity as a risk factor during their pregnancies. Resources that are available today for maternal obesity are kind of hard to pinpoint. Number one, there's a Title V block grant that is a federal grant, and it is statewide, and there's also other states who are part of it, but it's a federal grant that allocates money towards specifically low-income mothers and expectant mothers. So today in the Omaha metro area, if a woman is expecting and below the poverty rate, they could potentially receive funds from this Title V block grant to help with costs of childcare, with just any kind of bills, with money, just troubles in general. And because of this, there shows that there's a direct link between low income and maternal obesity, as I kind of stated previously. And then also a resource that has just continued to grow is just the fact that perinatology is an ever-growing source of medical advice. Perinatologists specialize in high-risk pregnancies and kind of work in junction a lot of the times with normal OB doctors, and then also with pediatricians after delivery. So perinatologists will often monitor pregnancies and monitor maternal status of pregnancies when there's high risk associated with maternal obesity, like that gestational hypertension and diabetes, which a lot of the time cannot be controlled and leads to preterm delivery because mom and baby are so unhealthy. So those are resources that are really available right now. Just like with obesity, it's hard to point one finger at what the problem is. So it was difficult for me to find one solution. So there's not a whole lot of information out yet on the Title V grant, just because it is a newer grant. It actually was just approved in 2017. So that's the one issue with that. There's not a whole lot of feedback. Is this helping? Is it specifically helping with maternal obesity? There's just not a whole lot of research that's back from that yet because it's so new. And then the one issue with perinatology being a resource is that it's not proactive. Women are sent to perinatologists because they already have maternal obesity. And when you're already overweight, as many of us probably know, especially for women, it's so difficult to lose weight. And when you're pregnant already, it's especially difficult to try and lose weight. So that's the issue with perinatology. And a lot of the times they don't necessarily try to fix the problem of maternal obesity, but they just try to fix the symptoms and get through the pregnancy with a healthy mom and healthy baby. In addition to those resources, I also included the March of Dimes just because I use their website a lot to research this problem, because one of the main risk factors for preterm delivery is factors that are associated with maternal obesity. So risk factors relating to preterm birth. There's lots of resources for moms and for babies during those postpartum times. March of Dimes is a great resource that can help moms who might be dealing with preterm deliveries due to maternal obesity. So now I'm going to talk about what I think can be done today to help decrease the rates within my own community, although I think that these methods could easily be applied to anywhere and everywhere to try to combat it. So I think the number one thing with just general obesity and specifically maternal obesity is that when people are educated, we're more proactive about stopping a problem. So I think that if there was a specialized health program for young females within our public school education system, we would be able to stop the maternal obesity rate. So just a combination of like a dietitian, a health teacher, and then a PE, physical education teacher, working in conjunction with specifically combating reproductive years, young females, and educating them on, okay, so what does it look like? A healthy lifestyle now might be something that is different than a healthy lifestyle when and if you ever have children. And just being able to educate young females that are really getting in that high school years, getting towards that age of reproductive age, or already there, just being able to give more specific advice and education on what it looks like when you have maternal obesity and what the risks are associated with that, I think could help, one, decrease the rate, and two, just really establish some healthy lifestyle choices at a younger age that could carry over to when and if these young women ever decide to have children. So cost with that, I really don't think would be anything exponential. Most schools have physical education. It's a federal requirement for public schools, and just kind of specializing in females and women's health, and the same thing with health teachers, just having a brief female-oriented maternal obesity and maternal health class over that, and then specifically maybe a dietitian is something that wouldn't be included in a public school. So overall, I don't think there would be a lot of costs associated with this, and I think that it would be the number one way to combat this. My second idea is something similar to the Title V grant, but something more specifically allocated towards obesity, maternal obesity, child obesity, and it would be funds that are specifically designated towards healthier lifestyles, healthier and affordable foods, education on maternal risk factors with obesity, and then how to combat them. I think this could possibly have a long-term effect on people, just having those resources where women aren't having to worry about costs of things as much, and being provided healthier foods, and then this could potentially affect future children and generations, and just seeing these healthy lifestyles from their mother and carrying on to maybe just decreasing the general obesity rate. But specifically, I think there should be funds allocated for expecting mothers. So here are my references to everything, and I hope you guys enjoyed. Thank you.